Hello friends, in this video we'll be seeing the most common causes among the virology. Okay, so first question here is most common cause of sporadic encephalitis is HSV1 human simplex virus 1, sorry, herpes simplex virus 1, sorry, and most common lobe which is involved in this sporadic encephalitis which is caused by HSV is temporal lobe. Okay, so again they can also ask the most common cause of moderate meningitis. It is nothing but there is a recurrent lymphocytic meningitis. Again here the cause is a HSV1 only. Okay, so always remember except the genital lesions, so most of the herpes virus infections is caused by the type 1. So here, so among the orofacial lesion, okay, so most caused by HSV, the most common affected site is buccal mucosa, but the frequent first primary infection or the lesion, it is usually seen in gingivostomatitis and the pharyngitis. Okay, that will be a manifestation, and most common recurrent lesion, it is in herpes labialis. Okay, so here these are the points you want to remember for herpes. So which is the most common affected site, what is the primary lesion, and what is a recurrent lesion, that is. So here the most among the now chickenpox, the most common infectious complication, it is a secondary bacterial infection. Okay, so next it is what is an extracutaneous, that is a CNS manifestation. It is in cerebellar ataxia, encephalitis and aseptic meningitis. But what is a serious complication which leads to the fatal rate? It is in varicella pneumonia. Okay, so it is nothing but it is in pneumonia. So what is the most common complication of this zoster in the elderly patient? It is in post-herpetic neuralgia where the pain will be very severe. Okay. So what is a congenital defect among the cytomegalovirus? That is in PHG. Okay. Fatigue and hepatosplenomegaly and the jaundice. So what is the most common cause of mononucleosis like syndrome? That is, it is like infectious mononucleosis, but it is caused by here CMV. Okay. What is the most common site involved in the herpes zoster? That is in D3 to L3. As you know that herpes zoster, it will be affecting a particular dermatome of lower respiratory tract infection in the infants causing bronchiolitis, pneumonia and tracheobronchitis. It is an RSV. So here it is an RSV, and most common ear defect which is caused by rubella, that is it is a nerve deafness. Okay, so among the congenital rubella syndrome, if it is a nerve, it is a nerve if it is a ear, it is a nerve deafness, or if it is an eye involvement, it is in first it is in salt and pepper retinopathy, next it is in cataract. And among the cardiac manifestations, the first it is in patent ductus arteriosus, pulmonary artery stenosis, and it is in ventricular septal defect. So which is the most common vector causing Japanese encephalitis? It is in Tritinurhynchus, that is in Culex Tritinurhynchus, and among the second most common, it is in Vishnu. So here friends, you want to remember this again 2 points. So what is the most common cause of diarrhea in children? It is in rotavirus, whereas in older children and the adult, it is in norovirus. Okay. What is the serious complication of the rotavirus vaccine? It is an intussusception. So here some of the important genotype are the most common genotype of rotavirus seen in India. It is in G1 and the P8. So next, what is the most common cause of the BART? It is in Verruca vulgaris, and in the children it is in Verruca plana. The most common organism causing intrauterine infection, it is in cytomegalovirus. Okay, so that is a triad. I told you petechiae, hepatosplenomegaly and jaundice. So this is again the most common organism which is complicating the organ transplantation. They can give a history like a patient had a renal transplant. So after that he was developing a infection. Also, what is the most probable organism? So here the key point, it is an organ transplantation. So the most common cause of meningitis and meningoencephalitis in children, if it is among the virus, you want to think about the enterovirus, and if it is among the bacteria, you can go for either Streptococcus A galaxiae or Listeria monocytogenes. So here the most common serotype, that is a polio serotype to cause epidemic, it is in type 1, whereas vaccine derived poliovirus, it is in type 2. Vaccine associated paralytic polio, it is in type 3. Okay, so how you can remember is, so D, no, so D it is for double, so D, so here it is in 2, so just like D for double, like that you can remember. So most common site of the Negri bodies, it is in cerebellum and the hippocampus, and the strain used for Negri body, it is in cellular strain. So the most common complication of the influenza virus, it is in bacterial pneumonia. So again for chickenpox also it is in varicella pneumonia, and here it is in pneumonia. Okay, so here the causative organism is aureus and the Streptococcus pneumoniae. So what is the most common manifestation of mumps? As you know, it is in bilateral parotiditis. Second most common, it is in epididymoarthritis. So what is the most common complication of measles? It is in otitis media. So always remember, all life-threatening causes, it is in bacterial pneumonia only. So what is the most common genotype involved in the measles? It is in India, it is in D8, whereas globally it is in B3. HIV infection, that is in. So most common opportunistic infection among the HIV, it is in tuberculosis. Pneumonia, it is in pneumocystitis. So first common cause of meningitis, it is in cryptococcus. And again important point in cryptococcus, you must not remember a 2 point. So one, it is an India ink strain. Second, it is an, what is it? Niger seed agar, that is an bird seed or the Niger seed agar, which produces an black color colonies. So most common cause of diarrhea among the AIDS patient, it is an Cryptosporidium. Okay. So most common cause of seizure or any focal neurological deficit or any space occupying lesion, it is in toxoplasma. Okay. So here most common cause of blindness among the HIV, it is in cytomegalovirus. So neoplasm, as you know, it is in Kaposi sarcoma, and lymphoma, it is in non-Hodgkin lymphoma, and parasitic infection, it is in strongyloids. So again friends, if you are coming across the word strongyloids, so 2.1, it is causes in hyperinfection syndrome, and second, it is in the larva currents. As you know, because this migrating larva, it usually runs very fast, like 10 centimeter per hour. Okay, so hepatitis is hepatitis E. Okay, and again in pregnancy, it is in hepatitis E. So 2 points. One, it is in sporadic, another it is in fulminant. So if you are coming across in B, it is in transfusion related, most common cause of chronic hepatitis and carrier state, and also causing in cancer. Okay, so these are the for hepatitis B. So coming for C, it is only for chronicity and again also causing the cancer. So for cancer, you want to remember B and the C, that is in hepatocellular carcinoma. Okay, so and then for D, which is if they are asking most common cause of fulminant viral hepatitis, it is in D. Okay. So just for recap, sporadic and fulminant viral hepatitis in pregnancy, it is an E. Transfusion or chronic, carrier state or the cancer, so both. Okay, like hepatitis C and hepatitis B. So they won't give both the options. Okay, so and what is the cause of fulminant viral hepatitis? It is in hepatitis D. Okay. So thank you friends, and this completes the virology session, and so upcoming will be on parasitology and the mycology. Thank you friends.